Hello, welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top news. Delhi's health infrastructure, top key takeaways from panel's recommendations. Taking note of problems affecting the healthcare services at the government-running hospitals in Delhi, a committee constituted by the Delhi High Court recently submitted its interim report listing the immediate, short-term and long-term measures required to be implemented for the betterment of the system. Here are the key takeaways from the interim report of the panel, which was submitted to the High Court. First is the addressing staff shortages. Second is utilizing visiting consultants, compulsory residency programs, implementing public-private partnerships, expanding ICU bed capacity, establishing centralized control rooms, introducing reverse referral policy, converting hospitals to medical colleges, creation of Delhi State Health Authority, and lastly is extending CGHS rates. Many cancer drugs remain unproven 5 years after accelerated approval, according to a study. The promise of early access to potentially life-saving drugs through the US Food and Drug Administration accelerated approval program often comes with high hopes for patients battling debilitating or fatal diseases. However, a recent study sheds light on the reality that many of these drugs fail to demonstrate significant benefits within a reasonable time frame. Dr. Ezekiel Emanuel, a cancer specialist and bioethicist at the University of Pennsylvania, underscores the urgency of obtaining definitive answers about the efficacy of accelerated approval drugs within 5 years. He says thousands of people are getting those drugs. That seems a mistake if we don't know whether they work or not. Initially created in 1992 to expedite access to HIV drugs, the Accelerated Approval Program has since expanded, with cancer drugs comprising 85% of approvals. While patients gain earlier access to medications, the trade-off is that some drugs may not ultimately deliver the anticipated benefits. The study published in the Journal of the American Medical Association reveals that between 2013 and 2017, a significant portion of cancer drugs granted accelerated approval did not demonstrate clinical benefits in subsequent trials. Despite this, many of these drugs were converted to a regular approval status. Simple oral spray prevents UTIs for up to 9 years. Euroimmune, an oral spray vaccine, has shown significant efficacy in preventing recurrent urinary tract infections for up to 9 years in over half of participants. Euroimmune utilizes inactivated versions of bacteria commonly responsible for UTIs to stimulate long-term immune protection. Administered as a pineapple-flavored spray under the tongue daily for 3 months, it offers convenient alternative to injections. A recent study led by clinicians at the Royal Berkshire Hospital demonstrated the vaccine's safety and efficacy, with around 54% of participants remaining UTI-free during the 9-year follow-up period. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.